Every single year, millions of people walk out of their doctor's office with a clean bill of health. Normal cholesterol, normal blood pressure, normal blood sugar, and then, 6 months later, they have a heart attack. Or they're diagnosed with early-stage cancer that's been silently growing for years. Or they collapse completely out of nowhere with no warning signs at all. How? How does that happen when the doctor said everything was fine? Here's the truth nobody wants to tell you, and I mean nobody. The standard blood panel your doctor orders, it's outdated. It was designed decades ago, and it misses one of the most powerful early warning signals the human body produces. There is a blood test, a single test, that can detect hidden inflammation, predict cardiovascular risk, and flag dangerous immune responses before you feel a single symptom. It costs almost nothing. It's widely available, and the vast majority of doctors never order it. Stay with me, because what you're about to learn could genuinely save your life, or the life of someone you love. Let's start with what your doctor actually checks during a routine blood panel. You've probably seen the list: cholesterol, LDL and HDL, blood glucose, thyroid levels, maybe a CBC. That's a complete blood count. These are fine, these are useful. But here's the problem. They're reactive markers. They tell you damage has already happened. High LDL doesn't mean plaque is building in your arteries right now. It just means there's potential risk. High blood sugar doesn't tell you your pancreas is struggling. It tells you it's already been struggling for a long time. Think of it like this. Imagine your house is on fire, but you only have a smoke detector in the basement. By the time it goes off, the entire upstairs is already burning. That's the standard blood test. It's a detector that goes off too late. Now, what if I told you there's a detector that goes off the moment the first spark ignites? Before any damage, before any symptoms, before anything. The test is called high-sensitivity C-reactive protein, or hs-CRP. C-reactive protein is a molecule your liver produces in response to inflammation, and inflammation, chronic, low-level, silent inflammation, is now understood to be the root driver of almost every major disease we fear. Heart disease, type 2 diabetes, Alzheimer's, certain cancers, autoimmune disorders, depression, even accelerated aging. All of them have chronic inflammation as a common thread. The regular CRP test exists, but it only detects extreme inflammation, like from a serious infection. It's like a scale that only registers when you put a truck on it. The high-sensitivity version, the hs-CRP, can detect whisper-level inflammation, the kind that has no symptoms, the kind that's been quietly destroying your arteries and organs for years. These were people who would have been told by their doctor, "You're fine, go home." So what does a good hs-CRP number look like? Let me break this down clearly. The results come back in milligrams per liter, mg per L. Below 1.0 milligrams per L, you're in low-risk territory. Your body is calm, your inflammation is minimal. Between 1.0 and 3.0 milligrams per L, this is moderate risk. Your body is dealing with something. It could be diet, stress, poor sleep, a low-grade infection. This is the zone where lifestyle changes make a dramatic difference. Above 3.0 milligrams per L, this is elevated cardiovascular risk. Your immune system is in a constant low state of alarm. Something is wrong and it needs attention. Above 10 milligrams per L, your doctor will want to investigate for acute infection or serious illness. Here's what's shocking. Studies suggest that a large portion of people walking around right now, people who feel perfectly healthy, are sitting between 2 and 5 milligrams per L, quietly inflamed, unknowingly at risk, and they have no idea, because nobody ordered the test. This is the question you're probably asking right now. If this test is so powerful, so affordable, so available, why isn't it on the standard panel? Honestly, there are a few reasons, and none of them are great. First, medical guidelines are slow. The evidence for hs-CRP as a routine screening tool has been building for over 2 decades, but major health organizations still classify it as optional, not standard. Second, insurance reimbursement. In many cases, unless a patient has existing heart disease risk factors on paper, insurers won't cover the test, and doctors operating under time pressure don't fight for every optional add-on. Third, and I want to be honest here, awareness. Many general practitioners are not cardiovascular specialists. They rely on the standard panel because that's what the system trained them to use. This doesn't make your doctor a bad person. The system is the problem. But understanding this means you need to be your own advocate. You can ask, right now, at your next appointment. 4 words. Can I get hs-CRP? That's it. 4 words that could change everything. Now here's where it gets empowering. Because if your levels come back elevated, it's not a death sentence. Inflammation is one of the most responsive biological processes to lifestyle changes. Here's what the research consistently shows. Number 1, omega-3 fatty acids. Found in fatty fish like salmon, sardines, and mackerel, or in a high-quality fish oil supplement. Multiple studies show omega-3s can significantly reduce hs-CRP levels within weeks. Number 2, sleep. This one surprises people. Sleeping less than 6 hours a night is directly associated with elevated CRP. Your body repairs inflammation during deep sleep. Deprive it of that window, and inflammation compounds. Number 3, cut ultra-processed food. Refined sugar, seed oils, artificial additives. These are fuel on the inflammatory fire. The research here is overwhelming.
Even reducing processed food intake by 30% can noticeably shift CRP markers. Number 4, movement. Not brutal exercise, just consistent movement. A 30-minute walk 5 days a week has been shown to reduce CRP markers meaningfully. Your lymphatic system needs movement to clear inflammatory waste. Number 5, stress management. Chronic psychological stress triggers the same inflammatory cascade as physical injury. Meditation, deep breathing, time in nature, these aren't luxuries. They're anti-inflammatory medicine. And number 6, curcumin, the active compound in turmeric. Dozens of clinical trials have shown curcumin to be one of the most potent natural anti-inflammatory compounds ever studied. Pair it with black pepper for absorption, and it rivals some pharmaceutical anti-inflammatories in terms of CRP reduction. Here's the bottom line. The modern medical system is extraordinary at treating disease, but it is shockingly poor at predicting it. The hs-CRP test is a rare exception. A simple, affordable blood marker that can see into your body's future and give you time to act. You don't have to wait for symptoms. You don't have to wait for a diagnosis. You just have to ask. At your next doctor's visit, ask for the high-sensitivity CRP test. Write it down. Put it in your phone right now. hs-CRP. And if you found this video valuable, if you think one person in your life deserves to know about this, share it with them. Because this channel exists for one reason only, to give you the health information that the system forgot to. I'll see you in the next file. Subscribe for more hidden health files. New video every week.